Move to Phil Brick with the UN Foundation.
Thank you. Yeah. Hi. Well, my name is Bill Philbrick, and I'm with the United Nations Foundation, which I think many of you might know about. That was the UN Foundation was started a number of years ago with the $1 billion contribution from Ted Turner. And it's affiliated with the United Nations system, but the United Nations specifically is based in Washington, D.C. So one of the key initiatives for the UN Foundation is something called the mHealth Alliance. And I'm with the mHealth Alliance as a global advisor. So the mHealth Alliance is all about the promotion of the use of mobile technology in global health. So what does that have to do with workforce? Well, quite a bit. We know, for example, in the state of global health, and particularly in the developing world, that the greatest burden and preponderance of global health issues lie in the developing world, particularly in Asia and Africa. This is where most people are dying or suffering of HIV, where most of the women who die during childbirth are located in Asia and Africa. We know this is where most of the diarrheal diseases, which is the leading killer of children in the world, and plus a whole bunch of other health situations that can easily be preventable. With that said, we also know that there's been a huge influx of funding, particularly by the U.S. government and other governments like Great Britain, France, and a whole number of other governments, into addressing these health problems. And one of the ways the money goes is to building the capacity of the workers who are in these countries to address the health problems themselves. But there's a problem that sometimes arises with that. And one of those problems is there's something called brain drain. And so a lot of these nurses and doctors who have been trained with funding from, let's say, the U.S. government have actually left the country, understandably, to other countries like England, to the United States, where they probably could use, where they could probably put their skills and lead a better quality of life. But the consequence of that is that there's been a dearth of particularly medical specialists in places, particularly Asia. So what we are seeing right now is the statistic is there's probably 250,000 people to every one doctor in developing countries. And that's a really imposing figure. Well, what is mobile technology? And specifically, mobile phones have to do with that, and how can that address the whole workforce capacity issue? Well, let's think about this for a moment. Mobile phones, you all know, and I'm sure everyone in this room has access to a mobile phone. There are 7 billion people in the world, 6 billion of which have access to a mobile phone. That's pretty amazing, right? We know in India, for example, I don't know if any of you have seen the statistic. In India, just as an example, more people have an access to a mobile phone than they have access to a toilet. Amazing. So you have this device, this amazing device that can do an amazing amount of things, but what we're sort of seeing what we're using it to do is to do something called task shifting. So task shifting is a concept that actually developed, the term, I think, developed under a lot of the HIV program with the U.S. government, because what they're seeing is because there's a dearth of physicians and the highly skilled medical professionals, they're trying to find a way where they can get perhaps some of the people maybe with lesser skills and who have more access to the rural communities where actually a lot of these problems lie. And they use mostly through communities, people called community health workers, who have some very basic skills, mostly women, and are not really super highly trained. So what we're doing now in a number of cases is giving phones, or actually a lot of these women already have phones, and using, for example, algorithms for them, instead of whereby, for example, a woman who is going through issues of labor, instead of the first priority we want to do is get her to a skilled position. But if you're not able to do that, these mobile phones have, for example, protocols that can help walk through a community health worker through to recognize the various signs of an emergency obstetric situation. We're also using mobile phones with these algorithms and checklists to help them walk through a number of other different types of health situations to be able to give them information to address the situation. That includes HIV, recognizing childhood illnesses, etc. A really interesting project where this is being done on a very major level is a project by CARE in Bihar, India. Bihar, India is perhaps one of the, and I stand corrected, but I believe it's one of the poorest, but yet one of the most crowded or most populated areas of India, where we have some of the worst statistics around disease, particularly maternal mortality, where women are dying during childbirth or within 30 days of childbirth. So CARE International, which is based here in here in Atlanta, CARE received a $30 million grant for the Bill and Melinda Gates Foundation. And what they're doing is they've armed a lot of these community health workers who are women with these mobile phones, and these mobile phones enable the women to walk through, well, first of all, register the patients. That helps them guide in helps them enable and facilitate the delivery of care to these women. But more importantly, it gives them different protocols so that even though a woman might not be able to get to a physician, the community health worker who visits her actually is able to give maybe the second best type of medical service to that woman by running through various protocols, being able to recognize particular diseases or particular situations that would require moving that woman to a facility immediately. So we're seeing this also, we're using mobile phones for training of community health workers where they can actually go through modules. Again, this is also through the Gates Foundation project in India. In Bihar, they're doing training modules for these community health workers. So again, this mobile phone has an enormous amount of potential to address workforce issues, particularly in Asia and Africa, where these issues are predominant. Some of the challenges, though, that are faced is issues around privacy, because now you have community health workers, people in the community having access to such information. This is being addressed. Issues about, does this actually work? So we know that community health workers find it acceptable, they like using it, but we haven't yet built up the evidence base to show actually health outcomes that are associated with this so-called task shifting. Issues around gender, because what we're doing is we're empowering a lot of the community health workers, who are mostly women, with these mobile phones. And this sometimes creates issues in certain cultures where women are not allowed to, or where it's more culturally appropriate for the men to have phones. And then just lastly is around issues around standards. So what we are doing, we are task shifting away from the physicians and impose more of the responsibility for some of the delivery of medical services on these community health services, community health workers. And as a consequence, we need to establish standards, because that's where we get away from this, the professional level of expertise that we expect from the physicians. And thank you very much.